Do you find yourself waking up 2, 3 times every night just to use the bathroom? And the next morning, you feel exhausted like you barely slept at all? I understand that feeling. But here's what's worse. So many people over 50 think this is normal, that it's just an unavoidable part of getting older. But it's not. I'm Dr. Emily Carter, a sleep health specialist. In my 20 years of practice, I've worked with over 10,000 patients, from those who wake up just once to those who have to get up 5, 6 times every night. And I have good news for you. There are simple steps you can take tonight to significantly reduce how often you wake up. Today, I'm going to share 8 proven tips with you. And the last one is something most people never think of, but it completely transforms their sleep quality. If you want better sleep, subscribe to the channel and hit the notification bell so you don't miss my helpful videos every week. So let's start right away with the first tip, a simple timing change you can apply today. Did you know that when you drink water matters far more than how much water you drink? Here's what most people don't realize. Your bladder takes about 1.5 to 2 hours to process liquids. So when you drink water, tea, or milk right before bed, you're essentially programming your bladder to wake you up in the middle of the night. It's like setting an alarm you didn't ask for. Let me explain the 2-hour rule. If you go to bed at 10 p.m., your last drink should be at 8 p.m. I know this sounds early, but here's why it works. It gives your body enough time to process that fluid so you can empty your bladder completely before you get into bed, rather than having to wake up at 2 a.m. when it's full again. Now, I understand some of you need to take medications before bed. That's absolutely fine. Just take them with one small sip of water, not a full glass. That tiny amount won't fill your bladder enough to wake you up. I had a patient, Margaret, who's 67. She used to wake up 3 times every night and was exhausted during the day. She worried about falls in the dark and felt like she was losing her independence. The only thing she changed was moving her last drink from 9:30 p.m. to 7:30 p.m. Within 5 days, she was only waking up once. She told me she felt like she'd gotten her life back. Your bladder needs time to process fluids. Give it that time, and you'll see a difference from the very first night. But it's not just about water. There are specific drinks you absolutely need to avoid in the evening, and that's what we're going to talk about next. That afternoon coffee or that glass of wine before bed might be the main reason you're not sleeping through the night. Let me start with caffeine. Many people think caffeine only affects you for an hour or two, but that's not true. Caffeine stays in your system for 5 to 7 hours, and during that entire time, it's stimulating your bladder. It makes your bladder muscles more active, which means you feel the urge to go more often. So that 3 p.m. coffee, it's still affecting you at 8 or 9 p.m. Now let's talk about alcohol. I know many people have a glass of wine to help them fall asleep. And yes, alcohol does make you drowsy initially. But here's the problem. Alcohol is a powerful diuretic, which means it makes your body produce more urine. Even worse, it disrupts your sleep cycles, so you wake up more easily. You might fall asleep faster, but you'll wake up more during the night. Other drinks to watch out for include carbonated beverages and chocolate drinks, especially in the evening. They all contain substances that can irritate your bladder. Here's my rule. No caffeine after 2 p.m. and no alcohol within 3 hours of bedtime. A study published in the Journal of Clinical Sleep Medicine in 2013 found that caffeine consumed even 6 hours before bed reduced total sleep time by 1 hour. That's significant. When you eliminate these bladder irritants, especially after 2 p.m., your bladder stays calmer and less active at night. It's not about never having coffee or wine again, it's about timing. Now, even if you've limited your fluids, there's a special technique that helps you completely empty your bladder before bed, and that's what I want to share next. This is the technique that many of my patients call a game changer, and it only takes an extra 2 minutes. Here's what double voiding means. You go to the bathroom, empty your bladder, then stand up and walk around for a minute or two, then sit back down and try to go again. I know it sounds strange, but let me explain why this works so well. Many people over 50 experience incomplete bladder emptying. This doesn't mean there's anything seriously wrong, it's just that as we age, our bladder muscles don't always contract as strongly as they used to. So you might think you've emptied your bladder completely, but there's actually still some urine left. That remaining urine means your bladder fills up faster during the night. When you change position, stand up and walk around, gravity and movement help that remaining urine flow down to the bottom of your bladder. Then when you sit back down, you can empty that extra bit. You don't need to force it, just sit calmly for 30 seconds to a minute and see if anything comes out. Often, it does. I had a patient, Robert, 58, a retired teacher. He was waking up 2 to 3 times every night. After just 1 week of double voiding before bed, he went down to 0 or 1 time per night. He couldn't believe such a simple change made such a big difference. A completely empty bladder means more time before it fills up again, which means fewer times waking up. Simple as that. If you're finding these tips helpful, please hit the like button to let me know. It helps me continue creating valuable content for you. Now, if you're taking any medications, this next tip is extremely important. If you're taking blood pressure medication or water pills, the timing of when you take them can determine whether you sleep through the night or not. Many people over 50 take diuretic medications, commonly called water pills. These are often prescribed for high blood pressure, heart conditions, or swelling. They work by helping your body remove excess fluid. That's great for your health, but here's the problem. If you take them at the wrong time, they can significantly disrupt your sleep. Most people take their medications in the morning because that's what they've always done. But what happens is this. You take the pill in the morning, it works during the day and helps remove fluid, but then by evening and nighttime, fluid starts accumulating again in your body, especially in your legs and lower body. Then, when you lie down at night, all that fluid redistributes back into your circulation, your kidneys process it, and your bladder fills up repeatedly. The solution? Talk to your doctor about taking your diuretic in the early afternoon instead, around midday. This way, the peak effect happens in the afternoon and early evening. You empty your bladder before bed, and you're not dealing with fluid redistribution all night long. Now, this is very important. Never change your medication schedule without talking to your doctor first. But this is a conversation worth having. A study of over 700 patients with high blood pressure found that taking diuretics in the afternoon instead of the morning reduced nighttime bathroom trips by 40% without affecting blood pressure control. This is a 5-minute conversation with your doctor that could transform your sleep for years to come. The next tip relates to something many people over 50 are dealing with but few know how to handle properly. If you have prediabetes or type 2 diabetes, this might be the hidden reason you're waking up constantly. Let me explain what happens when your blood sugar is elevated. When there's too much sugar in your blood, your kidneys try to get rid of it by putting it into your urine. That extra sugar in your bladder irritates the bladder lining, making you feel like you need to go more often. Even worse, sugar pulls water with it, so you're not just dealing with irritation, you're also producing more urine volume. It's a double problem. This is especially important to manage in the evening. If you eat a dinner high in refined carbohydrates or sugary foods, your blood sugar spikes right before bed. And that's when all these problems happen. What can you do? Focus on controlling your blood sugar, particularly in the evening. Avoid foods high in sugar and refined carbs after 6 p.m. Instead, choose meals with lean protein, healthy fats, and plenty of vegetables. These keep your blood sugar stable. I had a patient, Linda, 62 years old, with an HbA1c of 7.8%. She was waking up 4 times every night and felt miserable during the day. After she improved her dinner choices, reducing carbs and increasing protein and vegetables, her HbA1c dropped to 6.5% over 8 weeks. Her nighttime bathroom trips went down to just 1 or 2 times. She told me she finally felt rested again. According to the American Diabetes Association, every 1% reduction in HbA1c can reduce diabetes-related symptoms, including nighttime urination, by 25 to 30%. Controlling blood sugar isn't just good for your overall health, it's the key to better sleep. Now, there's a physical cause that many people don't recognize, and it has to do with your legs. Have you ever noticed your legs or ankles swelling by the end of the day? That's water accumulating there. And at night, where does that water go? It goes right into your bladder. Let me explain the mechanism. During the day when you're sitting or standing, gravity pulls fluid down into your legs and lower body. That fluid just sits there. But at night, when you lie down, gravity is no longer pulling it down, so it redistributes back into your circulation. Your kidneys then filter all that extra fluid, and it ends up in your bladder. That's why you wake up multiple times. Your body is processing all that accumulated fluid. Salt makes this problem much worse because it causes your body to retain more water. The more salt you eat, the more fluid accumulates in your legs, and the more you'll need to urinate at night. This is especially important if you have heart issues or high blood pressure. Your goal should be less than 2,300 milligrams of sodium per day. If you have heart concerns, aim for less than 1,500 milligrams. How do you do this? Avoid canned and processed foods. They're loaded with hidden salt. Read nutrition labels carefully. Cook at home more often where you control the salt. Use herbs and spices for flavor instead of salt. I know this takes effort, but the payoff is real. Less salt equals less water retention, which equals less urine production at night, which equals better sleep. It's that straightforward. And to help address this fluid accumulation even faster, there's an evening habit that's incredibly effective, and most people have never heard of it. This is the tip that 90% of my patients didn't know about. But when they tried it, they saw results from the very first night. Let me explain two options. First, compression stockings. These are special socks that apply gentle pressure to your legs throughout the day. This pressure prevents fluid from pooling in your legs in the first place. You want compression stockings with a pressure of 15 to 20 millimeters for sleep purposes. You wear them from morning until evening, and they keep fluid circulating instead of accumulating. The second option, which is completely free, is elevating your legs in the evening. Here's how. Lie down on your bed or couch and prop your legs up on pillows so they're higher than your heart. Do this for 20 to 30 minutes before you go to sleep. You can do this while watching TV or reading. What happens during those 20 to 30 minutes? The fluid that accumulated in your legs during the day drains back into your circulation. Then you get up and go to the bathroom before bed, and you've already emptied that fluid. You're not waiting until 2 a.m. or 4 a.m. when it finally redistributes while you're sleeping. I had a patient, Thomas, 71 years old, with mild leg swelling. After he started elevating his legs for 30 minutes every evening, he went from waking up 3 times down to once, and that happened after just 3 days. This is one of the simplest but most effective interventions. No cost, no side effects, just gravity working in your favor. If you're finding these tips helpful, please share this video with your loved ones. They might need it too. And now, we come to the final tip, the one I promised at the beginning. This is the technique that few people know about but can completely change how you handle the urge to use the bathroom. The most powerful thing you can do isn't controlling your bladder, it's controlling how your brain responds to your bladder. Here's what I want you to understand. Many times when you wake up, it's not because your bladder is actually full. It's because your brain has learned to overreact to even a small signal from your bladder. Over time, your brain and bladder have developed a pattern. Bladder sends signal. Brain says, wake up immediately. But you can retrain this pattern. This is called the urge suppression technique. Here's how it works. When you feel the urge to go to the bathroom in the middle of the night, don't immediately jump up. Instead, do 3 to 5 quick Kegel exercises. A Kegel exercise is simply contracting your pelvic floor muscles, like you're trying to stop urinating midstream. Do 3 to 5 quick squeezes, then take some deep breaths and wait. Here's what happens. That intense urge you feel will peak and then it will fade. It always does. It gets really strong, then it goes away. Usually this takes about 30 to 60 seconds. Once that urge fades, you can calmly get up and go to the bathroom if you still need to. But often you'll realize you can wait longer, maybe even until morning. This technique has strong scientific backing. A study published in the Journal of Urology in 2019 followed 312 participants. After 12 weeks of consistent practice, 68% reduced their nighttime bathroom trips by 1 to 2 times per night, and their sleep quality scores improved by 40%. That's remarkable. Let me teach you how to do a proper Kegel exercise. Contract your muscles like you're trying to hold back urination. Hold for 3 to 5 seconds, then release completely. Repeat this 10 times, 2 to 3 times per day. You can do this anywhere. No one will know you're doing it. I had a patient, Susan, 66 years old, a retired nurse. She was skeptical at first, but after 6 weeks of persistence, she went from 3 to 4 times per night down to 0 or 1 time. She told me, "I've taken back control of my sleep." This technique requires patience and consistency, but it's also the most powerful and longest-lasting intervention. No medications, no side effects. You're retraining your brain, so now you have all 8 tips to stop waking up multiple times every night. Remember, stop drinking water 2 hours before bed. Avoid caffeine and alcohol in the evening. Use the double voiding technique. Adjust your medication timing. Control your blood sugar. Reduce salt. Elevate your legs or wear compression stockings. And practice Kegel exercises with urge suppression. You don't need to do all 8 at once. Start with 2 or 3, then gradually add more. But even if you sleep through the night, there are still serious mistakes destroying your sleep quality that you don't even realize. In my next video, I'm going to reveal the 4 most common mistakes harming your sleep and 3 simple techniques to help you fall back asleep quickly if you wake up. Don't miss it. If today's video was helpful, please like, share, and subscribe. And comment below, how many times do you wake up each night, and which tip will you try first? I'll read and respond to every comment. Thank you for watching. Take care of your sleep because you deserve restful nights. See you in the next video.